You're still watching Breakfast Central on News Central. Now, don't forget you can follow us on all social media. We're on Facebook, we're on Instagram, and of course, you can stream live on YouTube. Catch us live on StarTimes channel 274 and on Avil TV channel 23.
All right, so the continent of Africa has recorded over 5.9 million COVID-19 cases. It's now time for the COVID-19 updates with Israel Eferobo. Israel, good morning to you. Where are we now in terms of the numbers?
Good morning to you, Lisa and Oluchi. Yes, indeed. Let's go straight now and bring you some of the updates that we have on the continent. But we'll just stick with Nigeria, where the National Primary Healthcare Development Agency says it has completed its first phase of the COVID-19 vaccination campaign, with about 3.9 million persons receiving jabs of both the first and second doses of the Oxford-Astrazenca vaccines. Now, the executive director of the agency, Dr. Faisal Shuaib, says the new doses of vaccines will be used to execute the second phase of the nation's vaccination drive. Now, he also added that the country expects another 3.9 million doses of the Oxford-Astrazenca vaccines from the World Health Organization's COVAX facility. Take a look.
The country has officially ended the first phase of its strategic COVID-19 vaccination plan and is now preparing to commence the second phase in the next few weeks. We have also received communication about the delivery of the following vaccine shipments in the coming weeks: 3,577,860 doses of the Pfizer-BioNTech or Moderna COVID-19 vaccine in Q3 from the COVAX facility. 29,850,000 doses of the Johnson & Johnson COVID-19 vaccine procured by the federal government through the African Union.
We must be mindful of discontinuing public health and social measures. Lifting them too early could see us losing some of the gain that the vaccine have enabled us to make. On our part, WHO will support Nigeria to maintain strong surveillance and detection system, reassess and bolster treatment capacity, and advocate for stepping up the supply of critical medicine, including medical oxygen, for the treatment of severely ill patients.
As Nigeria stands up in the rest of Africa and in the world as a leader on this vaccination, we must prepare through good social mobilization, through the traditional and religious leaders, through community leaders, to ensure that all people understand the criticality of taking the vaccine and the low.
Well, there you go. Indeed, the National Primary Healthcare Agency Executive Director Faisal Shuaib, and also the representative of WHO, Walter Kazadi, who's a doctor, and giving us an update there on Nigeria. But according to the Africa CDC, the continent has reported over 5.9 million cases with over 152,000 deaths. Now, tests carried out is pegged at over 55 million, while the number of recovery stands at over 5.2 million. Well, that'll be all from Nigeria, but don't go away just yet, as we are going straight now to Zimbabwe, where Lala is standing by to tell us the update from that part of the continent. Lala, good morning.
Morning, how are you?
Very well.
Okay, so the president, Emerson Mnangagwa, last night, he gave the country an extended 14 days, which is 2 weeks of level 4 COVID-19 regulation. Obviously, this level 4 COVID-19 regulation comes with certain aspects, such as a wearing of masks that is mandatory, social distancing, sanitizing, and also a ban on intercity travel, and a ban basically on just aimless traveling, as he puts it, and that if you are to travel, you should have an exemption letter, a letter that explains why you are traveling. And on top of the agenda of this 14-day extension of the lockdown is a target of 1 million people to be vaccinated The country received 2 million doses this past week, so they are aiming on vaccinating 1 million people, which will then put Zimbabwe on the required or the much anticipated herd immunity.
All right, Lala, thank you very much for that one in terms of the updates with the vaccinations. At least there is light at the end of the tunnel, because it's not just about extending 2 weeks lockdown again in Zimbabwe. People have really suffered in terms of this lockdown since COVID-19 started. Yes,
actually, talking to different people, people are more happy, or they are accepting of the 14-day lockdown, because there was so much talk, especially on social media, that the country was going on a 21-day total shutdown. However, that's not what the president said last night. He actually maintained the level 4 lockdown, and which basically allows people to move around, though there are certain regulations that are expected, but it's generally business as usual, though the operating hours here were cut short, but it's not as bad as a total lockdown that people feared.
All right, thank you very much, Lala, our correspondent in Zimbabwe, for giving us the latest in terms of the lockdown and getting ready for the vaccinations in the country. We're not sure which vaccines have arrived in Zimbabwe, whether it's Johnson & Johnson, Pfizer, Moderna, AstraZeneca. Any ideas which one, Lala, before you go?
It's the Chinese Sinopharm.
Oh, Sinopharm. All right. Thank you very much, Lala. So we'll come to you perhaps next week to know how far the vaccinations are going. The target is 1 million.
1 million.
Are people accepting it? Are people skeptical? Thank you very much, Lala. And to you, Israel.